Hello and welcome to Pitt Street Research. My name is Stuart Roberts and I'm one of the founders of our firm. And with me today is Philip Daffas. Philip, welcome. Philip is the CEO of Painchek, ASX PCK. And Philip, it's fair to say that Painchek and Philip Daffas have had a great year, 2019.
We have had a great year, 2019.
Yeah. Tell us about Painchek first and how you had a great year.
Right, Painchek is the world's first pain assessment technology that uses artificial intelligence to assess pain levels for people who can't verbalise their pain.
Right. Now, there was a time when nurses in, say, aged care facilities or working with children who are prelingual couldn't tell whether someone was in pain or not. We've all had experience with our own children, say, where they're crying and you can't tell what the matter is. Now, you've come up with a imaging tool where just showing the patient's face with a mobile device, and suddenly you can tell the level of pain that patients are suffering from. And that's an enormous breakthrough, isn't it?
It is. I mean, pain assessment for people who can't verbalise is multidimensional. Okay. You need to look at various aspects, including the face, body movement and behaviours. Yes. What we have done is we've taken the best in class that's been available for many years, manual paper-based systems. Right. We've intelligently automated the process, and then we've added in artificial intelligence to do the most complex part, which is the facial assessments. Right. Combining that gives us a very accurate pain assessment tool for those people.
Certainly. And the peer-reviewed data show that you shoot the lights out compared to the previous rating scale, and the ease with which you can do the analysis.
Correct. We're not changing clinical practice. We're improving the clinical process. Right. And we're also fitting in perfectly with workflow in aged care in hospitals, which means it's easy for nurses to use. They understand the process, but they can do it now at the point of care in a mobile environment and very rapidly. Sure.
Now, talk to us for a moment about why in aged care it's important to be able to assess pain with people who can't really verbalise why they're in pain.
Well, 80% of people in aged care are living with pain.
Right.
Many of them, up to 50% of them, are living with dementia or have cognitive impairments.
Right. I read somewhere about half of all residents of aged care facilities will have dementia of some kind.
Correct. Right. Or cognitive impairments. Right. Therefore, they're not able to verbalise accurately their pain at times.
Okay.
So therefore, having a standard tool to assess pain means you can differentiate between whether the resident's in pain or whether the resident's behaviour has been caused by the disease.
Right.
Very different treatments. If you can find the underlying cause, such as pain, you can treat the pain and improve the behaviour.
Yes.
If you misdiagnose it and think it's the dementia causing the problem, you can lead it to wrong treatments, such as antipsychotics.
Just make things worse, basically.
And then we do is make things worse.
Right.
So having this available in aged care is a revolution, and we believe that that's going to also impact hospital and home care as well.
So you made that an important first target market. Now let's come back to what a great year it was. If you look at the numbers, you had about 1,800 beds in aged care facilities in Australia that were regular users of the Painchek system.
At the end of last year.
At the end of last year. Now fast forward to end of 2019. Sorry, so end of 2018, I should say. You're at 1,800.
Correct.
End of 2019, you'd gotten all the way to around 32,000 beds.
Correct.
So a 16-fold growth in the course of the last 12 months.
Absolutely.
What was the appeal in terms of who you were selling this product to down under?
Or multiple appeals. First of all, obviously, it gave for them a tool to assess pain. It reduced the level of pain on average across their residents.
Right.
And finally, nurses had something to actually utilise that actually help them do their job better.
Right.
So plus we promoted it very well, we positioned it very, very effectively.
Yes.
And we've got a great team out there selling the concept and also providing the service.
Sure. And you're now taking this to other markets. You've got CE mark approval, so you're talking to European providers in the same area.
Correct. We've actually on 4 markets now. Australia is our main market with 80% plus of our sales, but we're also now in the UK with a distribution partnership plus our own people. We've sold into Singapore and we've also sold into New Zealand. So we've shown that this product is acceptable and desirable on an international basis.
Sure. And US next year, depending on how your regulatory filings are going with the FDA.
Correct. We're going through the FDA right now as a de novo device. And we're going to do some clinical study work in the US, some basic work which will take us through to this year, and the output of that then we should have de novo clearance by end of this year, early 2021.
Okay. Now, it was interesting to me, we had a federal election here in Australia in May 2019. Now, not long before that, Prime Minister Scott Morrison announced that about 100,000 Painchek licences would be acquired by the federal government for use in the aged care industry here. What motivated that decision, do you think? And it's taken about 8 months, but you finally got them to sign on the dotted line down in Canberra, as I understand. Right.
Very much so. I think the thing that drove that really was the Royal Commission on Aged Care. That's been going on for about a year and a half.
Right.
So as part of that Royal Commission, Painchek got elevated by a number of our clients as a solution to the Royal Commission on Aged Care. I met with Minister Wyatt a number of times, from January through to May.
And he actually appeared with you in front of the cameras when this deal was announced. Yes.
It was a joint announcement. It was a federal government announcement in May 2019, allocating $5 million to the rollout of Painchek for a 1-year period across aged care in Australia for up to 100,000 people living with dementia.
Okay.
And as you say, that was signed off in December, and that's been actively implemented right now.
Right. Now, on the international stage, you've also had a very interesting adventure with Philips, the European medical device superpower. They have a program where they evaluate about 2,000 companies, mostly startups. Or you're a bit beyond startup stage, obviously, to see if you fit with them. Tell us about that program.
Yeah, look, Philips Healthcare are the largest patient monitoring company in the world.
Right.
They are always on the lookout for technologies that will fit in with their hospital monitoring technologies.
Right.
And therefore they have a special group called the HealthWorks Group, which is like a venture startup facility, accelerator facility. They're on the lookout for best technologies that can fit.
Right.
And twice a year they run a program called HealthWorks, and they invite in 6 to 10 companies to participate through this 3-month process.
And you were one of the fortunate 6.
We were one of the fortunate 6 in the Europe and Asia group.
Right.
And that culminated in December, just last month, where we presented to their CEO and their CTO and their 200 senior Philips management team in Eindhoven, and we presented their breakthrough day. And that part of that presentation was not just about our technology, but about how we would fit in and how we would work with Philips in their hospital sector.
Okay. So, Philip Daffas, when we first started covering you a little over a year ago, you were capitalised, I think, at about $20 million. Now you're a $200 million company. So, you've grown from an infant into a toddler. What's the path from being a toddler to a teenager in market cap terms?
I just think we need to continue doing what we're doing. For me, strategy is all about making the right choices.
Right.
We've made the right choice in 2019. We've got a clear strategy for 2020. We're going to implement on the government a program in Australia. We're going to continue to expand into the UK, into Europe. We're looking at collaborations in hospitals with companies like Philips Healthcare, which is an enormous opportunity, and we're building for the Kids app.
Okay.
So, and then on top of all that, we'll be ready for the US by 2021 for both the adults and the kids. So I see great upside for this company.
Okay. Philip Daffas and Painchek, keep up the good work.
Thank you very much.
Thanks for coming in.
Thanks, Stuart.